The third form of pharmaceutical incompatibility is pharmaceutic. This is caused by a chemical or physical incompatibility when two or more drugs are mixed together. This occurs when drugs are mixed inappropriately in syringes or infusion fluids prior to administration. Example for this is phenytoin when given with when given in acidic pH, it will cause precipitation. Another is aminophylline, which is basic. When mixed with epinephrine, it decomposes at alkaline pH. The second type of our incompatibility is the therapeutic incompatibilities. This happens when two or more drugs are administered and response is different from what is expected. Undesirable pharmacological interaction between two or more ingredients can lead to potentiation of the therapeutic effects of the ingredients, destruction of the effectiveness of one or more of the ingredients, or occurrence of a toxic manifestation within the patient. An example of therapeutic incompatibility is the drug interactions. It involves precipitant drug or the drug, chemical, or food causing the interaction, and the object drug, the drug affected by the interaction. Drug interactions may increase or decrease pharmacological response due to the presence of another drug, or an herbal medicine, a food or drink, treatment, or environmental chemical agent. There are different types or kinds of drug interactions. It can be drug-herbal, drug-food, drug-laboratory, and drug-drug interaction, which can be further classified into pharmacokinetic and pharmacodynamic interactions. First, we have drug-herbal interaction. In column A, here are the drugs or the object drug that is affected by the herb and the resulting effect in the body. For digoxin, when mixed with St. John's wort, it can result to decreased concentration of digoxin, hereby decreasing the activity. Warfarin and low molecular weight heparin, when mixed with garlic, can cause bleeding or hemorrhage. Warfarin also, when given together with Asian ginseng, can cause decreased concentration of warfarin. Barbiturates and benzodiazepines, when given with valerian herb, it can double the sedation. Hypoglycemic agents, together with ginseng, can have an increased hypoglycemic effect. Antihypertensives, when given with licorice, can produce antagonism. Monoamine oxidase inhibitors, phenylpropanolamine, epinephrine, and caffeine, when given with mawang, can result to increased blood pressure and irregular heart rate. The next type of drug interaction is between drug and food. The drug or the object drug, such as CNS depressants when given with caffeine, warfarin when given with green leafy vegetable, can produce antagonism, while tetracycline and quinolone when given with dairy products can cause chelation or complexation and causing decreased tetracycline absorption. Monoamine inhibitors, when given with tyramine-rich food such as beer, cheese, wine, chicken liver, can cause decrease in metabolism of norepinephrine, causing hypertensive crisis. Isoniazid, when given with histamine-rich food such as cheese and tropical fish and tuna, can cause flushing reaction with headache, difficulty of breathing, nausea, and tachycardia. Bisacodyl, when given with milk, can cause alteration of pH, causing premature liberation of bisacodyl. Aspirin, when given with caffeine, can cause also alteration of pH, causing increased aspirin absorption. Metronidazole, when given with alcohol, such as wine or beer, can provide disulfiram-like effect. Spironolactone, when given with banana, can produce hyperkalemia. Digoxin, when given oatmeal, it can decrease amount of digoxin. And biphosphonates, when given with food, can cause decreased bone absorption. Another is a summary of the drugs that can be increased and decreased by food. So, acarbose, griseofulvine, itraconazole, metoprolol, thiophylline, phenytoin, and metolazone can be increased when given with food, while alendronate, captopril, erythromycin, isoniazid, penicillamine, penicillins, tetracycline, and quinolones are decreased by food. The next type of drug interaction is between drug and laboratory tests. Penicillin, chloramphenicol, vitamin C, isoniazid, and streptomycin can alter glucose in urine and can provide false positive results, while chlordiazepoxide can also alter thyroid function tests and can provide false negative results. Rifampicin, vitamin B2, chloroquine, and metronidazole can cause discoloration of the urine, and allopurinol can cause alteration in blood cholesterol level, providing false positive results.